Aboriginal and Torres Strait Islander peoples talking on Aboriginal and Torres Strait Islander health. We're featuring predominantly on Twitter, so if you're not on Twitter, jump on today and have a sticky bag.
Great, and the hashtag is?
Hashtag I hate May Day 16.
We must have a bit of paper with that written on it. Pass us one of those bits of paper so we can hold it up. There we go.
There we go. And you'll notice
there is the hashtag.
If you do search on Facebook as well, I have noticed that the hashtag comes up as well.
Fantastic. Now, my shadow portfolio is regional health, and I'm really interested in inequality and where inequality, economic inequality maps across to health inequality. And one of the really stark gaps that we see in Australia is the difference between people who live in the city and people who live in the country, people who live in the bush. You've got higher rates of chronic disease, higher rates of avoidable hospitalisations, avoidable deaths, high rates of non-survival of cancer. We know that a whole heap of this has got to do with distance. We know that a whole heap of this has also got to do with wealth inequalities. But a big piece of that is also the gap that we have not closed between white Australia and black Australia. What do we got to do?
What have we got to do? From my point of view, one of the things that came out of the inaugural Suicide Prevention Conference, which happened last week, and is also Suicide Prevention, Family and Young People's, the topic for IHMA Day, is actually listening to Aboriginal people. And that's what's so important about things like IHMA Day and other events, is we know our solutions better than anybody else, and rather than a top-down approach, we really want to see our stories being listened to and our solutions. We have great stuff happening in communities, and unfortunately that great stuff is often not heard about, and all you hear about is the negativity, so no one thinks that we know what's going on and what we can do about it. But if people actually spent the time talking to our elders, talking to our young people and hearing from them, I think we actually would be a much better chance of closing the gap by the 2030.
Fantastic. Look, I was up in Grafton on the weekend, and I was talking to the people from the Aboriginal Medical Service. I was talking to the people from the Headspace, and they were telling really some heartbreaking stories about young Indigenous people and suicide rates. It breaks your heart whenever you see this. On the one hand, you don't want to talk it up so much that you encourage a daisy chain effect, but how can we get the balance between talking about this so we know how to address some of the problems, at the same time as talking about some of the positive, really positive stuff that's going out on in Indigenous community and Indigenous health?
I mean, for me, things like suicide and self-harm are an end product of other things that are happening in people's lives. We need to be focusing on all of the social determinants so we can actually create an environment where people are safer and happier and healthier. But we also need to be open about mental health as well. I still think there's a stigma. I mean, I've had close family members who suffer from mental health issues and have self-harmed or attempted suicide, and not being able to talk about it is actually really challenging. So we do need to be able to talk about it, but in a positive way, and actually work with people and look at solutions and actually invest in community-based mental health solutions, not just in, big institutions. We really need to be thinking about how we can assist people in community and also removing some of the stigma. But one of the other things for Aboriginal and Torres Strait Islander peoples, and it's something we discussed with Bronwyn Carlson earlier, is identity. I mean, Aboriginal people still struggle a lot with identity because the conversation's owned by non-Aboriginal people. And I think we need to be teaching in our schools what it means to be Aboriginal, and we should be promoting and celebrating our Aboriginal and Torres Strait Islander cultures. And I think that in the long term that will have a positive impact for our mental health as well.
Yeah. A year or so ago, Nova Peris and myself and Shane Newman put a lot of work on a parliamentary joint committee into the recognition of Aboriginal and Torres Strait Islander people in our constitution. And that point came up in a lot of the community consultations that we went through. If you don't recognise the first Australians in the constitution, if you're denying the past, if it's not in that founding document, how can we then move on to a whole bunch of these other steps that deal with inequality, health inequality, wealth inequality and identity? And I think that was a really powerful point.
Absolutely. We can't continue in Australia to deny the history, and we can't continue to whitewash our history, and I think that the longer we do that, the greater the impact it's going to be. And you mentioned closing the gap before, and we won't close the gap unless we recognise our histories and and some of the negative stuff that happened here. And it's not about making people feel guilty, but it's about recognising that our current prosperity is based on the attempted genocide of Aboriginal and Torres Strait Islander peoples and the theft of this land. And you know, we just need to recognise it and accept it as a country and look at how we can actually engage together.
Yeah, look, I think the politicians are behind the people on this way, not in front of it. I think the majority of Australians are saying, yeah, why the hell don't we do that? Why do we use the word love? We just think that was nuts. So, look, I'm a big supporter of marriage equality, but frankly, for my money, I'd be spending our time, our effort and our public dollars on a referendum next year on recognising the first Australians in the Constitution, rather than the government's proposal about having a divisive referendum plebiscite on marriage equality. I just think that's a waste of money. We should just get on with that stuff.
I agree with you, that is a waste of money. I think the majority of Australians are very happy for marriage equality, and I think the government just needs to get on with it,
Get
really.
on board. So I'm going to ask you this. We talked about how do you balance that stuff about talking about the problems without leaving people with an overwhelming, perception that there's nothing good happening in Black Australia. And I know that there are a whole bunch of really good young leaders, young advocates coming through, together with great Australians that everyone looks up to and thinks, people like Uncle Pat Dodson and a whole heap of leaders from his generation.
Absolutely.
Tell us some of the people that you see that are coming through who are great role models for your mob and that we should be hearing more from.
Oh, look, there's so many people actually, and I think Twitter's been a great platform to connect with people. I mean, Luke Pearson, Celeste Little, and I think there's a whole range of people like Joe Williams. For me, and the other thing that I like is all of these people that I connect with on Twitter, we don't agree all of the time, but what we do is we're happy to support each other, be there for each other, and we actually support each other through the things we're in agreement on. And I think, I've got Nadia Neal here in the room. There's a lot of people I think are amazing spokespeople for our communities, and I just think that we need to be hearing more of the young people's voices. We do actually make up, I'm 35, so I'm old for an Aboriginal person. But when you've got 50%, when you've got 50% of the population under the age, I think, of 25, we really need to be showcasing and supporting the younger generations. We do some amazing stuff in communities. You look at AIM, that started, and I know that started with some young people. You look at Indigenous X, which Luke started. Aboriginal people are bloody amazing. When I look at the mainstream media, I don't see us represented. I don't see my family. I want the mainstream media to adequately report on us, and not just the negativity and not just the superficial stuff. Actually tell our stories as we see them, and I think that would actually make a significant difference.
What a great point to end on. So here we are in Wollongong promoting Indigenous Health May Day 2016. Get on board. Talk to you soon.
Thanks, guys.